Good evening, my name is Anna Warner. I'm going to be your student nurse for the day. If you could just confirm your name and date of birth for me. Okay, perfect, Mr. Benjamin. So it looks like you have a doctor's order for a Foley catheter insertion because since you broke your hip, you're not going to be able to get up and go to the bathroom. So what I'm going to do is I'm just going to insert a tube into your urethra, and it's going to go all the way into your bladder, and it's just going to drain the urine since you can't get up. Gloves on. Okay. So before I start, do you have any allergies to iodine, betadine, or latex that I should know about? Perfect. I'm just going to get you in a better working height. And so for this procedure, I'm just going to lay you flat in a supine position. And I'm just going to spread your legs a little bit. I'm going to uncover you, but I'm going to maintain your privacy. I've got a towel for you. Let's see. Okay. So first I'm going to start with some just normal perineal care with some soap and water. So I'm going to start at the tip, go around, get a new section, get some soap and water, go down, get a new section, get some soap and water, and clean the shaft and surrounding perineal areas. Okay? So now I'm going to discard these gloves and get some more Germex because I'm about to start my sterile field. Okay. So, let me get this out. Okay, that opened up, but normally that would break sterile field and I would need to start over. But for this video, I'm going to keep going. So I'm just going to make this a little trash bag and get this ready so I can discard my materials. So I would open away and side to side with the outer 1 inch. This. Okay, then I'm just going to take this and open it up by grabbing the outer 1 inch and drape this underneath. Okay, and now I'm going to put my sterile gloves on. I'll come over here so you can see me a little better. Okay. So, I'm going to open top, bottom, and the sides. I'm going to grab here. Get my hand in. I would get new gloves if that happened in real life, but I'm going to slide this hand in. Fix this glove a little bit. Okay, so now I'm going to put this next drape over you. There we go. Okay, I'm just going to get my materials ready. So, take this, set this over here. Okay, so I'm going to uncover your catheter. I'm going to discard that. And I'm going to connect the sterile water, discard that, to the port. So that will be ready. Okay, so now I'm going to open the betadine, put it on my cotton balls, discard that, and get my lubricant ready. Okay. So now I'm going to do some more sterile perineal care with these cotton balls and betadine. So I'm going to clean the outer one once, discard, go a little further back, discard, and then one more time around, and discard. Okay, I'm going to discard that. So now I am ready to insert your catheter. So I'm going to start by just inserting some lubricant directly into the tip of your penis, and that will just allow for the catheter to slide in easier. It'll be less uncomfortable for you. I'm going to discard that. So now I'm going to grab the shaft of the penis and I'm going to begin to insert, and if you experience any discomfort, just let me know. So I'm going to slide this in, and for a male, you insert the catheter all the way to the Y port, and then I'm going to hold it while I inflate my balloon. Now I'm just going to hold the syringe and let go. Okay, so now I'm just going to pull back until I meet resistance to ensure that it is in the bladder. Then I'm going to pull this down a little bit and attach the catheter with a little bit of slack to your leg so it won't move around. Here we go. And if I didn't have this device, I would just use some normal tape. Now I'm going to just hook this to the bed, not to the bed rail, to the bed. There we go. And now I'm going to collect my first specimen. I'm going to remove these gloves and go get a new pair real quick. Okay, I'm going to get a little Germex first, just in case. I'm going to get me some gloves. I'll go in. Sorry, I got you all exposed over there a little bit. I'm coming right back. Okay. So now I'm just going to take the all this trash away. Get my sterile specimen cup ready. Put this over here. I'm going to clean this betadine that I put on you off too, so I'm going to get just some warm water. So I'm going to clean once, discard or switch the washcloth to a clean area, clean a little further down, then one more time, switch again, and clean the rest of the perineal area. Okay, I'm going to discard that. And now I'm just going to collect the first urine specimen. So I'm going to take my sterile cup. I just ripped my pants. Okay, and so I'm just going to put this down here on the ground. And I'm going to get me a alcohol prep. And as I remove this, I'm going to clean it first, scrub the hub, and then I'm going to unclamp it. Take my specimen, clamp it back without spilling, and clean it again before I insert it back into the bag. And I take this and close it, and I'm done with this, so I'm going to cover them back up. And I'm going to remove this towel. Okay, and I'll be back whenever I have a doctor's order to remove that for you. So put the side rail back up. Put your bed in the lowest position. Okay, so now, come back. Hi, my name is Anna Morgan. I know you've already had me once, but if you could just confirm your name and date of birth again for me. Perfect, Mr. Benjamin. So I'm just gonna get some gloves. I'm gonna remove this catheter for you. I know you're more than ready to get this out of you. Okay, we don't have to worry with all that sterile procedure this time, so this should be quick and easy. Let me get my gloves on. Okay. Oh. We're getting there. Okay, Mr. Benjamin, I'm just gonna put you in a better working height. I'm gonna let this side roll down. Okay, so now I'm gonna uncover you. I'm gonna get this ready. And before I take this out of you, I'm gonna empty the urine that you have left in the bag. So I would just unclamp it, let all the urine out. And if I was trying to do an INO, I would measure the output there in that graduated container. But now I'm gonna just remove this, set it up here, get this tape off of you. And so when I take this out, I'm just gonna, if you experience any discomfort, just let me know. But first, it would be very uncomfortable if I didn't do this. I'm going to deflate the balloon so that it will come out of your bladder. So I'm just gonna hold it and get all this water out. Okay. So now I'm just gonna gently pull it out, and I want you to hold your breath for me. Okay? You can breathe again. I'm gonna cover you back up. And now I would document the procedure, and the patient tolerated it well. I'm gonna do a little bit of perineal care again before I go to clean up this lubricant. Okay? Okay, Mr. Benjamin, we're all done. I'm gonna put your side row back up. Put you back in the lowest position. I'm gonna cover you, get this off of you, cover you back up. We are all good.